these are the primary glands. So the pineal, you hear people talk about that third eye? Yeah. Actually, it's actually they indirectly referring to the pineal. The pineal gland is that's your sleep gland. And it's very sensitive to light and day, night and day. They're what we call the circadian rhythm. We'll go through that after. Hypothalamus, the pituitary, thyroid. You might recognize some of these parathyroids. They're close to each other. The thymus, this is all. And then adrenals, pancreas, and ovary. And then testes for men, depending on which way you're on. Women, a lot of women get into what we call adrenal fatigue. Most women, you'll see the thyroid, adrenal, a lot of them. And as you age, and ovary, if you've had, if they've been removed, imagine you removed your ovaries. Where's these hormones coming from? What about this guy? What happens if you remove this portion? Right? What happens? Where are the hormones? Now let's go into the female reproductive. Okay. Now, so this is estrogen. Estrogen doesn't work on just the reproductive area. It works all over your body. You've got estrogen receptors. Remember those little keyholes? You've got them all over your body. It's not only one area. You've got them in your brain. So that brain fog you get when you get older, or when your estrogen is probably a little bit off. You also have cholesterol buildup, plaque in the arteries. You have the reproductive area, right? Menstrual cycle, or lack of, right? Vaginally, it keeps matures the vagina and also keeps it lubricated, because a dry vagina actually becomes inflammatory and is a problem. It's a disease state, okay? Breast stimulates the development of the breast, and if you're breastfeeding, right? Uterus, it prepares the uterus to give birth. And bone, osteoporosis as you get old, right? Preserves the density.
Are you saying that the estrogen, too much of it would cause these problems, or too little of it would cause
both
problems?
Extremes.
Both.
Okay.
You want to stay with what we call normal for your body's needs. Progesterone is, I try to keep it simple. Progesterone, think of it as a seesaw. Progesterone balances the estrogen, okay? And progesterone is the one when you're pregnant. You see those happy pregnant women? Seriously, right? And they're calm towards, like, not the beginning, but, you know, they're ready to give birth. They're calm. They're happy. They're so full, but they're happy. They're progesterone. They're full of progesterone, right? So it's a calming hormone, and it offsets and balances the estrogen, okay? Testosterone. This is men and women, but the sexual area is the men. But the mind helps maintain a sense of well-being, okay, the sharpness, the men, the sperm count, the sexual development, and also bones and muscle. So women, as you age, we all have testosterone also. If our testosterone levels start dropping, you might find that as you age, you notice that what we call the body composition, the ratio of muscle to fat starts dropping. You become more fatless muscle, or your muscle becomes more lax. Not only because we're not exercising as much, but it's also partially contributed by the hormonal imbalances that are starting to occur. It doesn't mean that that's the solution. It could mean that maybe you can do exercise, but it also, you might want to look at this as an also